Welcome everybody, this is Desk Careers and our first live session with Dr. Paul Gelston, who is a clinical psychologist based here in Dubai and works at the Dubai Community Health Center. We're so excited to have you here today, Dr. Gelston. How are you?
Good, thanks. Good. I'm excited to be here as well. It's great to join you.
It's so exciting. I'm a little nervous because it is our first live session, and before you came on, we had some technical difficulties. So I'm excited that we've all made it and that we have students watching this. It's really a dream come true. Let's get started and talking about what you do right now at Dubai Community Health Center. I know that you work with children as young as 4, and you do work with adolescents as well. You describe the work that you do with the youth as psychological education assessments. You do a lot of diagnostic assessments, but you also work with adults in a therapeutic capacity. Can you talk to us a little bit more about what the differences are between working with the youth and working with adults, or is it the same?
Yeah, that's right. I mean, my role is kind of split into 2 parts. The first half really is conducting assessments of children and adolescents who have been brought to the clinic by either their parents or sent by school teachers who are concerned about their development or their skills or their behavior. So there's lots of referrals for things like autism, ADHD, developmental difficulties, things like dyslexia, academic issues. So children come in with their families and they would have, I suppose, a series of tests to determine, do they have autism, do they have ADHD, do they have dyslexia, and we conduct those assessments in the clinic as a team. And then the other half of the job is all about therapy and psychological therapy. So that's for children, teens and adults as well. So it's a range of different presentations in the clinic. Every day is different, which is good. I suppose the main difference with adolescents and adults is that in most instances, adults have kind of attended independently and they're quite happy to go there, whereas teens are usually brought along by parents who kind of want their teenagers to develop or to change in some way. So that kind of guides your work a little bit. So a lot of your everyday work with teens is very different to how it can be with adults as well.
Amazing. Let's talk a little more about the academic assessments that you would do for the youth. So you would assess them in the office, and then what happens moving forward? As a clinical psychologist, does the process end there, or do you work closely with institutions in helping these young people?
Yeah, it really depends what comes out of the assessment results. So for every assessment, a report is produced, and that details the child or the adolescent's IQ scores, their intelligence in various areas, but also their academic skills. And there's usually some form of assessment of their emotional or behavioral functioning. So depending on what comes out of the assessment really guides the next steps. Some young people will just go back to school, the report will be shared with school, and the school will implement the suggestions within the report. So that could be an academic recommendation, for example. Whereas some others might require therapy and they would attend weekly then for psychological support after the assessment process. So it depends really on the presentation.
That's really interesting. So how do you assess a 4-year-old? Is it through play? Is it more of a rigid assessment? I'm just trying to get my head around being a clinical psychologist and having a young child that can barely communicate. How does that look? I know that we learn these types of assessments in theory, but how do you communicate with a 4-year-old?
Yeah, I mean, you have to adapt everything that you're doing to the individual child. So the age is not necessarily the big issue or the relevant issue. It's all about the child's language, how's their social skills, how can they communicate and interact. And you have to adjust what you're doing with them depending on their skills and presentation. So there's different tests that you would use for children who don't have language, for example. Another big issue here is children who are fluent in Arabic or other languages, but maybe not so fluent in English. So there's tests for them as well. And then there's obviously standardized assessments for children who are fluent in English, but are maybe experiencing difficulties in some areas. So really any assessment should include using the standardized assessments because they're like the gold standard ways, but you will always have to observe a child's behavior as well. And that can be like in the clinic, in the assessment room, in the school. And, really most assessments should include an observation of the child in the school setting, just to see how do they interact with peers, how do they follow instructions in class, what are the concerns at school. And all of that's guided by the initial concerns, like why the child has been brought to the clinic in the first place, because a child who is maybe presenting with signs of autism would have quite a different assessment than a child who presents with ADHD or dyslexia, for example. And so it's all guided by the open communication as much as possible with school teachers and parents.
Amazing. Now, we are going to talk about your personal journey of how you became a clinical psychologist. I just want to take a little more time with learning more about the types of work that you do with the youth. So let's go back into the therapeutic style work that you do. I know that we have older secondary students watching us live right now, and they're learning a lot of theory. They're learning a lot of concepts out of a textbook. But you deal with patients every single day. You would have gone through the same type of curriculum and learning that our students have. How does that look when it's in front of a client? So what does therapy with a clinical psychologist look like? And how does it look different if it was just a regular psychologist?
Yeah. I suppose like in terms of therapy in the sessions for young people and adults, like the main goal is to try to understand like what are the current difficulties that they're facing. Some of the main things that I would work with are things like low mood or depression, and lots of anxiety presentations. A lot of young people present with like emotion or anger regulation issues, so like difficulties managing their emotions at times or becoming really overwhelmed by emotions. And the goal for me and the young person is to try to collaboratively understand like what is going on for them, what has kind of led them to this process, and what are the things that are like maintaining their current difficulties, what things are maybe helping, and how can we kind of set up goals to try to change maybe some of their thought patterns or some of their behaviors that might be making things worse. And so that's what it looks like in practice, really.
Okay, now let's hone in on Paul Gelston before he became doctor. Imagine being 16 all over again. What were you most interested in when you were a teenager, and how did you get from there to where you are today?
Yeah, like even like right up until I was 16, I had never really thought of a career in psychology. Like I really wanted to do teaching. I always kind of liked, being around kids and children, and that's what I wanted to do. So after I started studying A-level psychology, that's when the interest was kind of born, I suppose, and I just knew that it was an area that I loved. So at that point, I kind of just became more interested. I applied to college then to do psychology, like a bachelor's of science, and it all came from there.
So I know that it's years and years of education. How many in total for you, Paul? How long did it take you to go from A-levels to being a doctor as a clinical psychologist?
Yeah, you're right. I suppose in Ireland and the UK, like it varies across the world, but in Ireland and the UK, you have to do a minimum of 6 years of college. So 3 years for your undergrad bachelor's. I know that some countries do 4 years. And then you do a 3-year doctorate in clinical psychology. And that's when you really learn like all about therapies and different presentations and how to manage, psychological difficulties. And some people will do a master's in between those two as well. So that can be 7 years for some people. So it really varies, but it's minimum of 6 years study. But the good thing in Ireland and the UK is that your second time at uni, like your last 3 years are completely paid for. So it's all funded by the government. You're an employee of the government. You work in government hospitals while you're training, and they pay your university fees and the salary, which is great. So you're kind of a student, but you're actually not like in a lot of debt, which kind of helps helps the process.
So I want to go back to you doing an undergraduate degree. You were studying. How did it feel to think, I'm making a choice that, is going to affect my career for years?
Yeah, I think like psychology has a little bit of stigma attached to it, where it's like, oh, you're doing psychology, why would you do that? You'll never get a job. Like, what's the point? You're going to have to go back to college. And I think that's, I suppose, the main thing that people have to shrug off. And that was kind of a motivation for me to prove people wrong. I kind of liked the challenge of let's do this degree and find a job. And of course, it applies to so many industries. Like, so many employers love to see a psychology degree in their CV, and it's very applicable to different, industries. But I was really interested, like, in psychological approaches to mental health, and that's kind of what kept me on the road to clinical psychology. So it was a bit of a risk in terms of like comparing it to like a law degree or a degree in medicine. But I think if you work at it and kind of put the steps in place, you can still get a good career out of it.
Amazing. So you went from studying in London, working in Ireland, and here you are in Dubai. How did cultural change have an impact on working with patients between these three parts of the world?
Yeah, so the process was actually studying in Ireland and then studying in London and then moving to the UAE. So I suppose the biggest step was from Ireland to London, because I grew up in a tiny village in Ireland where everybody knows everybody. There's maybe a few hundred people locally. Everybody looks the same and kind of has the same interests, whereas London was just like a melting pot of so many cultures and ethnicities and religions. So that was a big change for me, and that completely applies to the UAE as well, of course. So I think that was the biggest change, but it's all about like, how can you kind of gain an understanding of a person's experience, presentation, difficulties, and family circumstances, whilst also thinking about like religion, culture, beliefs, attitudes, ethnicity, background at the same time. It's kind of like you have to pull everything together to understand someone. And I suppose in Ireland, it's maybe a little bit easier to relate to other Irish people because they've kind of had the same experience. But in London and obviously the UAE, you have to kind of be a bit more open-minded to other people.
What would you say has been the biggest challenge in some of the cases that you would be dealing with that would differ between the UK and Dubai? Sorry, the UAE.
I think it's just about awareness and normalization of some of the difficulties that people face. Like, some of the families I meet here have never ever heard of things like autism. They don't know what depression is. A lot of people do, and they're familiar with it, but some people don't. And I think that that's quite a barrier to what my work involves and to how to help people. And I think, in some ways, like all countries, there's still a bit of stigma lingering around, and we still have a lot of work to do in those areas. And like, that was a barrier in Ireland as well and in London. But I think it's just something that we have to work on globally, really.
So being a clinical psychologist, from what I'm hearing you say, is a lot more than just working with patients. There's a lot of educating the client, educating families with the client, and educating the community as well. How do you connect with other people in industry? Is it clinic by clinic, or is there a community, an association that you can be reaching out to for support?
Yeah, you're right. It is like a systemic thing, which means you have to link like yourself to other professionals, but also the community around you. And that's what your training's all about. So you learn all this while you're studying and while you're training to become a psychologist. So the whole way through your training, you will always like have supervision from other psychologists. And that can be like directly up to somebody who's more qualified and experienced, but also with other peers who are in your similar position. And that's, recommended and encouraged throughout your whole career. And then I suppose there's a responsibility for us to kind of reach out to the community and, try to, I suppose, normalize what psychologists look like and what we do, and normalize like the mental health discussion as well. And helpfully there are initiatives and there are different schools and companies that are trying to do this, like today's interview really. And I think that's a good way to kind of reach out and for the community to see you, but also to meet like people who might not be familiar with what you do or what your role involves, just to kind of make it a bit more mainstream really.
In front of us are students who have a set curriculum. I've shared some of the content that they're learning with you. We talked a little bit about it. How does learning about psychology and the concepts of psychology, how does that translate into practice?
Yeah, I suppose like one that always comes up, no matter what it is like the nature-nurture argument. And this relates to like different mental health conditions, different, developmental difficulties like autism and ADHD. And parents and clients will always ask, like, what has caused this? Like, is this a genetic thing? Is it something that I did as a parent? Is it, his or her upbringing that's caused this? And there's always, no matter what topic in psychology you're looking into, there's always a discussion about that and a debate about that. And it's still going on and there's no real conclusion to it. But I suppose that's where you kind of reach into the area of psychiatry versus psychology. And psychiatry is quite medically based, and they have, I suppose from a general point of view, they kind of view things more from a medical or like a nature perspective. Whereas psychology, I would argue, kind of sways towards the nurture side, which is about like relationships, experiences, and family, people around you that kind of shape who you are. And that's the biggest debate I think that continues today.
So let's talk a little bit about some of the taboos. What are some of the taboo, what people think a clinical psychologist is? What are some of those stereotypes that you kind of briefly talked about before that young people should be aware of?
Yeah, I mean, there's so many. I think people are always so weary of psychologists. They think that we're like these, mad scientists that can read people's minds and we know what you're thinking and we know like why you behave like this. And I suppose that's probably the biggest misconception. Even if you meet somebody like in a coffee shop or at a birthday party, it's like, oh my God, you're a psychologist. I'll stay away from you, or don't read my mind. And it's like, okay, I've heard that joke 5,000 times now. So that's like a huge misconception. And I suppose like when people ask me, my friends always ask, and it's like, you don't obviously read people's minds, but you kind of understand people's personalities a bit more by how they, kind of behave or how they interact or how they might be with their like boyfriend or girlfriend, for example. So you learn little bits about why people behave in certain ways, but you obviously don't read people's minds. So if that was the case, I'd be a millionaire. So that's a huge misconception. I think another thing is like that psychologists are a bit weird, or they, kind of have a very like scrutinizing professional stance in the therapy room or in general, and that they're like, I suppose, the professional full of knowledge versus the client or the patient. But actually it's the opposite of that. Like in therapy and in any therapeutic work, it's all about like the client themselves, and they're the expert, and my job is to kind of understand them in collaboration with them and understand like how we can help them to get better using what I've learned or what I've been taught that works and that can help them to achieve their goals or to develop their mental health. So there's misconceptions everywhere, but hopefully they're kind of fading away with different things like this that kind of tackle those a little bit.
What would you say a young person should be thinking about doing outside the classroom if they want to follow down a career path like yours?
Yeah, I think like in psychology, there can be a lot of competition, which inadvertently pushes like entrance grades up for university and college and stuff. And like, it's not just about that. It's really far from that. Like, it's all about your experience with people with disabilities or mental health conditions, or children with developmental disorders, for example. So it's all about exposing yourself to people who might use psychology services, and the sooner you can do that, the better. The earliest kind of experience I had was working in a nursing home for older people, and that was my first stepping stone from. I worked in McDonald's before that, so my first ever job was McDonald's, and then I went to a nursing home, and that was my stepping stone. I then worked for a charity for people with autism, and that kind of led me into an assistant psychologist role. So any kind of experience related to healthcare is relevant, as long as you can kind of take from it what would apply to psychology. So it's not just about where do you work or what's your experience, it's what can you get out of that. And that's what I tell anybody who wants a career in psychology or clinical psychology especially. It's, get as much experience as you can and make sure that it relates to psychology. There's probably no point in, studying an undergrad and working in Spinneys or one of the supermarkets for 3 years whenever actually you need to be working in healthcare or some form of mental health or supportive role if you can, because that's what's going to guide you into the career, far more than grades alone.
And I like how you talked about the different experiences, because very often I have students coming to see me saying, I need to get experience in a psychology clinic or in a hospital working with psychologists. But as you said, it's understanding the user's perspective as well. So getting experiences where you would be learning about people, really thinking outside the box and connecting the dots to the skills that could be transferred into that learning. So wonderful. Dr. Gelston, I could talk to you forever. I'm going to turn the question and answer session now and see if we have any questions coming in from students. We had a question saying, how did you decide to be a clinical psychologist, which you did answer. While we're waiting for any other questions, who was your role model? Why psychology? Did you know anybody, or was there a mental health issue that you had been exposed to when you were a young person that made you think, I want to help people and this is how I'm going to do it?
There wasn't one person as such. I come from a family of nurses and social workers and healthcare assistants in hospitals. So I was always kind of exposed to the healthcare industry, and I always kind of heard, healthcare conversations, and my parents would always watch those hospital dramas ER and shows like that. So I was always kind of brought up in that environment, and I think that's what swayed me in that direction as such. And I think I kind of just wanted to do something different. I didn't want to be a nurse or a social worker. I really liked psychology, and I thought I'll give it a go and hopefully make progress in that area. So that's how I ended up where I am, I think, from my initial experiences. My family were foster carers as well when I was a child. So we always had children who maybe lived with us temporarily or lived with us for a few years before they returned home. So I think we were always kind of in an environment of care and understanding another person's perspective. But of course, you don't need that, to kind of, to make a career in this area. But I think those experiences kind of pointed me towards it, at least to some degree.
We just had a question come through. Did you always work in Dubai, or did you start working in the UK? If so, which country did you have a better occupational experience in as a clinical psychologist? And how difficult is it to get into the field after university?
Yeah, so I started in Ireland, then moved to London, and then moved to Dubai. So I've been in Dubai for 4 years now. I think, to be honest, the work itself is good no matter where you are. I don't think it really matters what country you're in. I think the biggest difference between here and home is the fact that healthcare is so privatized here. Whereas in the UK and Ireland, anyone can access, psychological therapy and psychology support. And they might have to wait a longer time than they would in the UAE, but it's still open to everybody. So you probably see people in those countries who might not attend services here. So that's a big difference. But I think in terms of studying clinical psychology, I think the UK and Ireland is a great place to go. because it's so well funded and because, you know, you're kind of supported throughout the process financially. I think that's a huge difference compared to like the USA, for example, where you have to completely self-fund. So I think that can be like a big benefit to a lot of people. Like without that, I wouldn't have been a clinical psychologist because my family couldn't have afforded like, you know, 3 years, never mind 6 years of college. So I think if you're thinking about your studies themselves, like Ireland and the UK and probably Europe in general is a good place to go. But wherever you practice doesn't really matter as long as you're in a good service with a good team.
And how difficult was it to get into the field after you graduated?
It can be really competitive. So that's why I tell people, you know, get as much experience as possible, as early as possible. Like it's yesterday was the right time, you know, it's just start as soon as you can, even if it's one day a week or one evening a week that you're volunteering for like, you know, a mental health charity or some form of like support group within the UAE. Just approach them and ask, can I help out, you know, every Saturday or every month? And offer your services to that, because it is quite competitive and a lot of people kind of want the role of a clinical psychologist. I know the year I applied for the doctorate in London, there was, I think, 42 or 44 places, and there was over like 1,300 applicants. So it can be quite competitive, but you know, if you have the right experience, decent enough grades, you know, you should be able to do quite well.
Awesome. Would you recommend anyone considering a placement year? Would you recommend that?
Definitely. Like there's some degrees in the UK and Ireland where you might do like 1 year of placement within your 4-year bachelor's. So that can be a great way to get experience. And it really just depends on what your interests are. And that's an excellent way to get experience. I would recommend that if it's, you know, if it's part of the degree program where people are applying to. But of course, in your doctorate, you will do like six-month placements. So you will always be within a hospital or a clinic of some degree. I did 6 months in a prison as well. And so you will always have those placements as part of your doctorate. But if you can get them earlier, then of course that's a good thing.
So it's not one of the questions, but I want to ask it, and then I'll go back to the student questions. How do you not get attached emotionally to the cases presented to you?
Yeah, it's quite a difficult balance sometimes. You know, you always, you know, hold people in mind at different times and not necessarily in the therapy room. And your whole way through training, you're kind of taught about like different ways that you can manage this. You know, you have reflective practice groups, which means that you'll sit with other psychologists or your peers and talk through some of these issues. And there's different ways to make sure that you strike a work-life balance. And I suppose it's just about being content with the fact that you're supporting them in the best way possible according to like the medical guidance or the psychological guidance, but also you know, you're doing your best and they're doing their best, and you can just kind of strike that balance between becoming too invested but also supporting them to the right degree.
It must be really hard to detach when those cases get very, very personal.
Yeah, it can be, and I think in children's services that's such an issue as well, because you know, you meet such a wide variety of parents, and some of them come to the clinic and they're really like avoidant of diagnosis and they don't want to hear a diagnosis, and that can be quite tricky. Whereas others might attend and they're really, really hoping for a diagnosis and they really want confirmation of their concerns. So all of that has to come into your mind, and I suppose it's a constant juggle, but you kind of just learn to manage it really.
So going back to the questions from the students, one of the questions is, does the greater awareness in the UK bring with it less stigma than in Dubai?
A little bit. Like I think everywhere still has work to do. So it's not a case that, you know, everyone talks about mental health in the UK and everything's fine. I think the discussion is probably slightly stronger there. And it's, you know, part of soaps or TV shows, you know, it's openly discussed by celebrities a lot. So it does reduce the stigma a little bit, but we still have work to do. And there's great initiatives here as well by the government and by different charities and organisations that try to reduce the stigma in the UAE. So it's getting better, but I think everywhere has more work to do.
So what kinds of experiences of volunteer here in Dubai would you suggest the young person to consider doing? I know you talked about the experiences that you had, but now that you've been here for 4 years, you see how difficult it is to get work experience or even volunteering. What would you suggest somebody considering this for them to do here in Dubai?
Yeah, like I've had some high school students have come to me for their work experience week, so they might attend the clinic and shadow like my work for the week, which is a great way to get, I suppose, an early introduction to what the job actually looks like in reality. Another great thing is to like approach different charities or support groups or social groups. I'm also a clinical director for the Special Olympics, and we're always looking for volunteers to support, our days that we run for that. And that's a great way to interact and be exposed to clients who use psychology services. There's loads of charities and, all across the Middle East and the UAE especially that support different mental health conditions or different, developmental difficulties, for example. And you can approach them, contact them, send them your CV, just tell them that you would like a little bit of experience or you'd like to help out and volunteer your services as well. Because it may not be the exact job that you want and it may not pay the best initially, but it's a stepping stone in the right direction, I think.
Those are fantastic suggestions. And I can see that you're going to be overwhelmed with the applications for work experience, shadowing patients and at work. Going through the pandemic, you would have really seen an impact on your patients. How did the pandemic and how is the pandemic affecting your work? And what types of cases are you starting to see more of potentially because of the pandemic?
Yeah, I suppose one positive to come out of the pandemic is that more people are talking about mental health and emotional health. And a lot of companies approached us and said, can you please run a webinar for our staff or for our students or for the parents of our students to talk about mental health or to talk about stress or anxiety in the pandemic. So we have quite a lot of requests for that. A lot of people really struggled as well with the quarantine and the isolation that came with that. People really struggled when they weren't supposed to be outside. So we kind of seen an increase in the number of people who attended our services or who asked for our services. And we obviously had to adjust things as well. And a lot of us moved to online sessions for a while. So really it did change a lot of things and a lot of people did struggle. But I think a positive from that is that a lot of people have talked and opened up about mental health, which is a good thing.
Another question has just come through. Let's take you back to your placement at the prison. What was that like for you as a person and for your career in that psychological perspective?
Yeah, I suppose I had always kind of had an interest in forensic psychology, and I wanted to dip my toe in that swimming pool, so to speak, just to kind of see what it was like. So it was a 6-month placement so it wasn't exactly a prison, but it was a forensic service for people with mental health conditions who would otherwise be in prison. So they were in hospital, but they were still serving prison sentences. So it was quite an eye-opener, really. You came face to face with people who committed quite serious crimes. And I think that, in a way, the work kind of was similar to some of the other placements whereby you still have to, have an open mind and try to empathize with somebody's experience or position and to support their mental health and their well-being. Whilst also kind of juggling some of your own judgments and some of your own perceptions and prejudices that might be there in relation to, to their history. So it was quite a tricky placement, to be honest. Like, it does kind of expose you to people who, have quite, serious histories behind them and have quite, severe mental health conditions in some cases. And to be honest, it was a great exposure for me, but it was kind of enough for me as well. It's not something that I would like to do every day. And that was a great learning experience in that sense.
Thank you so much. It looks like we have asked all of our questions. I cannot thank you enough, Dr. Gelston, for being with us today and answering all of our questions and giving us an insight into your career journey and also into the types of work that you do, helping our students with some great tips. Just before we say goodbye, what would your top 3 tips for a budding, aspiring clinical psychologist be?
I suppose get your experience outside of academics as early as possible and vary it as much as possible. The second thing would be to embrace like all areas of academics, even if you don't like them. I always tell people this, that even you'll not love every aspect of psychology or every aspect of clinical psychology, but find the bits that you like and tolerate the bits that you don't like. And I suppose the third thing is probably about personal development and just try to, ensure that you're trustworthy, open-minded, and you can be relied upon. You can, support people. You can keep an open mind to what other people's experiences are and try to develop those skills in yourself as much as you can.
Thank you. Thank you so much. That brings us to the end of an amazing interview with Dr. Paul Gelston, who is a clinical psychologist working at the Dubai Community Health Center here in the United Arab Emirates. Thank you to all of our students for watching, and thank you, Dr. Paul, for being with us today. Have a great afternoon, everybody.